Hi, Dr. Hagmeyer here, and I've been getting lots of emails come in, and one of the questions that someone asked me was, how do I know if my immune system is attacking my body? And well, in several videos prior, we actually talked that you can, obviously there's certain tests that you can run, and specifically when it comes to the thyroid, specifically Hashimoto's thyroiditis, we're going to look at something called thyroid peroxidase antibodies and thyroglobulin antibodies. But the reality is that there's many people who already know that they have an autoimmune condition because they've already been diagnosed with maybe something like psoriasis or rheumatoid arthritis, maybe MS or ulcerative colitis or Sjogren's or scleroderma or lupus, and now even autism. Obviously if you have existing autoimmune conditions, that's one way of knowing. But another way that people really know that they're autoimmune is that many of their symptoms wax and wane, okay? And that's a really important, that's a key off, that I suspect when someone has an autoimmune condition. In other words, the symptoms, they come and they go, or they have flare-ups, okay? Symptoms that flare up are really a sure sign that you are most likely suffering from an autoimmune condition. Now, the third way that I start becoming suspicious that a patient is autoimmune, even if their antibodies came back negative, because sometimes that can happen. In upwards, I think it's 20 to 30% the research is showing now that depending on the branch of the immune system that's being affected, whether it's that Th1 or Th2 branch, a person's immune system may be so weak that they don't mount antibodies. Okay, the Th2 part of the immune system isn't able to mount the antibodies. So the third way, again, like I said, where I become suspicious that a patient is autoimmune is that they often tell me that many of the symptoms started after puberty, started after pregnancy, or started after menopause, okay? So the fourth way is that if you're taking a bag load of supplements, okay, and this is almost like 100% of the time. I had a lady just the other day, and she came into my office, and I've never seen a lady who has taken as many supplements. She literally came in, it looked like she was ready to open up a vitamin shop. I mean, she must have had 30 different kinds of bottles of vitamins in her bag that she brought into the office. I've never seen anything like it. So sure enough, when lab tests come back, like I said, and you test positive for autoimmune thyroid, but also it could come back testing positive for celiac disease, okay? So what I want you to know here is that if you're taking a slew of supplements, in many cases the supplements that you're taking could also actually be making your problems worse. They may be supporting the wrong branch of the immune system. Many kinds of vitamins nowadays that are store-bought vitamins or vitamins that you might buy from your friends have a lot of different fillers in them. They have binders in them. And these are really going to be typically problematic for individuals who suffer with autoimmune thyroid. Now, I want to talk about one more way that you might be suspicious of an autoimmune condition if you test negative for these antibodies, okay? So something else you need to know is that if you have mixed symptoms of both hyper and hypothyroidism, okay? So what makes me real suspicious if a patient comes in and they say they have heart palpitations and hair loss, okay? That's a big one for me. That's when I really start zeroing in on some of the other potential causes for this autoimmune thyroid. So again, one of the things that becomes super important, without belaboring this point, is, again, advanced testing as it relates to the triggers becomes really, really important. And it's important to know that once you've been diagnosed with an autoimmune condition, you need to identify as many of these triggers as possible. Identifying these triggers is really going to help you bring down this autoimmune attack so that you can really get your life back. Okay? What I want you to understand that's just so important, really just a message of hope, is that even if you do test positive for this autoimmune condition and it's just wreaking havoc on your health and just in your life, I want you to realize that you can get better, okay? It doesn't mean that you're going to be a lifetime of cortisone shots or taking anti-inflammatories or living on pain medications and antidepressants for the rest of your life, okay? Well, I hope you enjoyed today's success video, and next week's health tip, I'm going to talk more about some of the triggers that really cause this immune system to get really fired up and really what you can do to really calm it all down, okay? Well, make it a fantastic day, and as always, if you've enjoyed this video, please go ahead and share it with someone that you care about that needs to hear this information. Take care.